Welcome to Willamette Lane's Emergency Action Training Program for the Park Services Division. Willamette Lane offers a wide range of fun and exciting activities. However, to ensure the safety of our guests and employees, it's important to be prepared at all times in the case of an emergency. In the event of an emergency, Willamette Lane employees are required to follow an Emergency Action Plan, otherwise known as EAP. With a dedication to emergency preparedness, we can ensure the success of our facilities and the satisfaction of our patrons. This training program has two objectives. The first is to minimize the risks that Willamette Lane employees and our patrons could be exposed to. The second objective is to ensure that, as a Willamette Lane employee, you understand and are able to implement an emergency action plan in a number of various emergencies. In this training, you'll learn how to respond to potential emergencies that include a serious medical emergency, a chemical spill, and a building evacuation. You may encounter a wide range of other emergencies, but these are the ones most likely to occur specifically at our Park Services facility. Employees at all Willamette Lane facilities must know how to respond and control situations in their work areas, and often these situations will be medical in nature. There are two major types of medical incidents. A non-emergency injury is one that only requires first aid and is non-life-threatening. In these situations, it's appropriate to call MedExpress at 541-228-3111. A medical emergency may be life-threatening and requires a professional emergency response team. In these situations, you should call 911. Keep in mind that a non-serious emergency always has potential to escalate and become life-threatening. The following is an example of a medical emergency that could occur at Park Services. Are you prepared to respond appropriately?
I got my arm stuck in here!
In this particular situation, a Willamette Lane employee is seriously injured and needs professional medical attention. The first Willamette Lane employee to activate the emergency action plan is considered the first responder. It's the first responder's job to assess and control the situation. The first responder is responsible for designating a person to call 911, administering first aid, and allocating bystanders to perform crowd control. Calling 911 should always be the first step in any serious medical emergency. When calling 911, be sure to remain calm. Provide the operator with your name, location, telephone number, and as much information as possible about the nature of the injury or illness, including whether or not the victim is conscious. Do not hang up until you are directed to do so. Our address at Park Services is 682 36th Street in Springfield, and our phone number is 541-736-4104. The next step is to retrieve the first aid kit and AED if needed. Do not move the seriously injured person unless you have no other options. Remain calm, assess the situation, and if it's safe, administer first aid according to the level you're trained. At Park Services, there are first aid kits located in each vehicle. Also, kits are in the office, wood shop, and machine shop. Remain with the victim until paramedics arrive. Then try to keep him or her as calm and comfortable as possible. As soon as it's practical, notify your supervisor and risk manager. Fill out an employee incident form in pen. It's important to complete the entire form and use extreme detail about the events of the incident. Be sure to include any corrective actions that could be taken to reduce the likelihood of a similar incident occurring in the future. If a guest is hurt, fill out a patron incident report form instead. All those involved in the incident, including witnesses, are required to fill out a form. These forms are located on the printing webpage under Risk Management and at the front desk. There are many features that define hazardous chemicals. A chemical is usually considered hazardous if it's flammable, explosive, reactive to other chemicals, if it generates particles or vapors that are harmful to the eyes and lungs, if it's corrosive, poisonous by ingestion or absorption, or is radioactive. If you are responsible for a small chemical spill, make sure you take a careful approach in cleaning it up by first blocking off the area. If there's anyone nearby, remove them from the area to avoid potential harm. Then retrieve the spill kit. All spill kits contain protective clothing, including gloves, goggles, and paper gowns to prevent cross-contamination of hazardous chemicals. It is first necessary to put on the protective clothing. Then you must assess the spill. If the spill is of a manageable size, you can use the kit to contain it. However, if your kit does not contain the appropriate materials, or if you're unsure of your abilities to contain and clean it, you'll need to immediately call Hazmat. Their number is 1-800-597-1323. In this case, the gasoline spill is of a manageable size, so as an employee, it's your duty to remove it using the spill kit. First, place the barrier agent around the edges of the spill to prevent it from spreading. Some kits include a powder known as a solidifier, and others may contain an absorbent pillow to soak up the chemicals. In this case, the spill kit contains the powder that will solidify the liquid into chunks. You should use a shovel or dustpan to collect the material and dispose of it in the proper biohazard bags. Use the provided liner to line your spill kit bucket. Then place the biohazard bags, towels, and protective clothing into the bucket. You should then tie the liner, securely fasten the lid, and apply the warning label to the outside of the bucket. Lastly, it's necessary to call the Lane County Hazardous Waste Disposal Center for advice on proper removal of the contaminants. Their number is 541-682-4120. An emergency building evacuation would be necessary in case of a fire, explosion, suspicious package, or a bomb threat.
Call 911, there's a fire outside. Okay.
In the event of a fire or the need for an evacuation, Willamelane's fire alarm will be triggered. If the alarm does not automatically activate, you must manually activate the fire alarm system, which would not only operate as a signal to Willamelane employees to exit the building, but it will also notify an emergency response team that there's an emergency. At the Park Services facility, there are fire alarms located in the office, wood shop, and machine shop. 8 fire extinguishers are located at various points throughout the facility. After activating the alarm, proceed to the nearest exit in an orderly fashion. As you exit, notify others that you see along the way. When you get outside, you should meet at the designated gathering point in the parking lot east of the building. You should then wait for the emergency response team and for further instructions. As a Willamelane employee, You play a key role in recognizing and preventing emergencies in the workplace. Adhering to the risk management policies and following the correct emergency response procedures will help protect you and others in case of an incident. At some point during your employment at Willamette Lane, you should fully expect to respond to an emergency that may be similar to the scenarios in this training. If you have any questions, please contact your supervisor or Willamette Lane's risk manager.